In a world where medical advancements continue to change lives, a young girl named Sarah is fighting a battle that no child should ever have to face. At just 10 years old, Sarah was diagnosed with a rare, life-threatening disease. Her condition requires an expensive treatment that her family cannot afford. Doctors have made it clear that without it, Sarah won't survive. News of Sarah's plight has captured the hearts of thousands across the country. Communities have rallied together, launching campaigns and donations, trying desperately to raise the necessary funds. Yet, despite the overwhelming support from the public, the funds raised fall short of the immense costs required to save her life. Time is running out, and the clock is ticking as Sarah's condition worsens. In another part of the country, a renowned research hospital known for its groundbreaking work in medical treatments is now facing its own crisis. This hospital, which has developed several life-saving innovations and kept medical treatment costs low, has now fallen into bankruptcy. For years, the institution has been at the forefront of research, but a lack of financial support is forcing it to shut its doors. With so many lives at stake, the hospital has turned to the public for help, hoping to secure donations. Unfortunately, the donations received so far have been insufficient, and the future of this vital institution remains uncertain. The policymaker sat alone in his office, reflecting on the growing crises unfolding across the country. The urgency surrounding Sarah's condition, paired with the situation at the hospital, weighed heavily on his mind. He had dedicated his life to serving the people. But now, as he looked out over the city, he knew that this was a defining moment. The needs of the people, especially the most vulnerable, were falling through the cracks. He questioned how a nation that could boast of its medical advancements could still let people like Sarah suffer due to financial hardships. The stories he had heard over the years had made him determined to change things. But now, seeing this direct impact, he realized that it was time to take real action. His mind began to race, formulating ideas on how he could ensure that no one else had to go through what Sarah and countless others were facing. The policymaker could not stand by and let Sarah's fate be decided by the limitations of her family's finances. He knew that he could not help every person in need by just throwing money at them, but this particular case with Sarah felt personal. He used his own personal savings to cover the bulk of her treatment. Along with the help of his colleagues and some of the wealthier citizens, he organized a donation campaign to rally more funds. Though Sarah's treatment was covered, the policymakers soon realized that this could not be the long-term solution. There were thousands more just like her, families in crisis, facing huge medical bills and a broken system that had no safety net. He understood now that he could not keep fighting the battle for every individual alone. A more systematic approach was needed. Determined to find a more sustainable solution, the policymaker began consulting with experts from various fields. He gathered data from government agencies, analyzing how many people were affected by diseases requiring expensive treatments. He worked with healthcare economists, statisticians, and policy advisors, looking for trends that would help him craft a law that would address the core issue of access to treatment for all, not just a fortunate few. He began to see a clearer picture, a healthcare system where only the rich could survive, while the poor were left to fend for themselves. He knew he had to act quickly to change that, but he also knew that passing a law without widespread support would be impossible. He needed data, evidence, and public backing. After analyzing the data, the policymakers set to work drafting a comprehensive health assistance policy. This new law would focus on people with curable diseases who could not afford treatment. He knew that health should not be a privilege of the wealthy, and he began to think of how he could prioritize treatment based on urgency, financial status, and the severity of illness. He also recognized that the policy should not be a one-size-fits-all solution. It needed flexibility to address the diverse needs of the population. The idea was simple: to ensure that no one had to die because of lack of access to affordable medical care. The bill would create a fund, secure government insurance, and provide financial assistance for those in need. As the policymaker worked on the health assistance bill, another urgent matter came to his attention. Research institutions, which had been the backbone of many medical breakthroughs, were facing their own financial crises. These institutions had developed life-saving treatments and therapies, yet they lacked the resources to continue their work. The policymaker realized that medical research and innovation needed just as much support as healthcare for individuals. Without strong funding for research, the progress of medical science would stagnate. The policymaker decided that any solution for healthcare reform had to include provisions for the future of medical research. It would not be enough to fix one part of the system while neglecting the other. The policymaker knew that to pass his proposed bill, he needed more than just good intentions. He needed hard facts, real-world proof. To convince the Legislative House to approve the necessary funding for research and development, he gathered data showing the undeniable impact of medical innovations. These breakthroughs had saved countless lives and improved the quality of life for millions. With this data in hand, the policymaker prepared to present the House, determined to make his case clear. He compiled statistics showing how medical innovations, fueled by research grants, had not only provided cures but also reduced healthcare costs by preventing diseases from progressing to more serious stages. He worked late into the night, knowing that this was a moment when his proposal would either succeed or fail. The future of research depended on this critical evidence being accepted and acted upon by the lawmakers. As the policymaker's proposal gains momentum, the public support grows exponentially. Citizens from all walks of life gathered together in the heart of the city, marching to the government building to show their support for both the health assistance program and ongoing funding for research. The people understand that without these changes, future generations will continue to face the same struggles. Sarah's story, along with countless others, has brought the urgency of the situation to the forefront. The rally is filled with passionate voices calling for immediate action. People carry banners with powerful messages like "Save Lives" and "Support Research," chanting in unison, their voices echoing through the streets. The sheer energy of the crowd is palpable as they march together, unified in their demand for change. Sarah, now healthy, watches the event unfold from the sidelines with her mother, both smiling as they witness the power of community and collective action. This rally is a turning point, the moment when the people rise up and make their voices heard. The policy passes, and with it, a new era of healthcare begins. The research hospital that was once on the brink of collapse now receives the necessary funding to continue its vital work. Sarah, once frail and on the edge of death, walks confidently through the hospital's doors, her mother by her side. The hospital is alive again. Doctors and nurses bustle around, and patients, once worried about the future, now have hope. The hospital is thriving, a beacon of medical innovation and care. Sarah, now a healthy young girl, is a living testament to the success of the new healthcare policies. The policymaker's vision has come to life, creating a system where healthcare is accessible to all and no one is left behind due to financial barriers. It's a new beginning for the hospital, for Sarah, and for the countless other individuals who will benefit from this monumental change. The research institution is once again a place of hope and progress, a key player in finding the next medical breakthrough. The future looks brighter than ever before as the policymakers' initiative transforms the healthcare landscape. Change is possible when we take action together. Every person, every institution, deserves the support they need to thrive. It's time we make a world where healthcare and innovation are accessible to all. The story of Sarah and the research hospital is only the beginning. If we stand united, we can make a world where no one is left behind and every life is valued. The future is in our hands, and it's time to act.